little different point of view. My job is to work with the partners in our community on our community health assessment and our community health improvement plan. So we really have kind of a tight-knit group that's working on this, and so I'm actually one of the people sitting around the table talking about goals, looking at Healthy People 2020, and so I want to tell the story kind of from the standpoint of how we used Healthy People 2020 to pick our priorities, where we had issues, where it worked for us, what I would do differently, and how we've used it to engage our community and our partners. So, like I said, I'm from the largest county in Montana. We're located in south central Montana, and again, like I said, about 140,000 people in our community. We do have Billings, which is the largest city and the only actual city in Montana, and surrounding us then is very rural areas, and some are actually considered frontier. And so we work with a very diverse population because we do see some of the urban issues, but then we see some very rural issues within our county too. I work for Riverstone Health, which is actually the local health department. So we're Yellowstone City County Health Department doing business under the name of Riverstone Health. But we offer all the traditional public health services that you can think of: environmental health, WIC, maternal and child health, kind of the population health, communicable disease. In addition, our agency has some federally qualified health center, hospice and home care, and some dental work. So we have a big kind of variety of services that we offer. I have to kind of start this story by introducing you to the Alliance. Within Yellowstone County, we have two hospitals, Billings Clinic and St. Vincent Healthcare. They actually share about 50-50 of the people and patients in the surrounding area. And the reason I think that's important is because one of the unique things that we have going for us is we have highly, highly competitive hospitals. So while we only have two, they're directly in competition, and this is really one of the only areas in which they have started to jointly work. Other than that, they're in fierce competition. I get emails about, I'm providing you with this, but don't pass it on. Those kind of things. So it's a different environment in which we've had to work and come together to make some conclusions. So just to share with you some of the results of our community health assessment. You can see here, this is our prevalence of total overweight, and Yellowstone County is in the red color. And the reason I want to show this is because when we talk about choosing our priorities, if I were to choose priorities based on just our data alone without looking at Healthy People 2020, we might have seen some different priorities emerge. So when we look at this one, it's pretty clear that we need to work on overweight and obesity in our community. As you can see, we're higher not only than Montana, but also the US. And the one thing that this graph doesn't show is we actually had a 10% increase over the course of 5 years. So we're not only getting fatter, but we're getting fatter faster than most people. And as you guys all know, this is why we're concerned about overweight and obesity and all the other health issues that come with it. So I know I'm preaching to the community when I do this, say this, but or to the choir, that's what it is, preaching to the choir. But this has really been an impactful slide in our community as we've looked at this, for people to understand why when we talk about overweight and obesity, this should be a priority issue in our community. So this was chosen as one of our priority areas. Pretty straightforward, even though I haven't told you where we stand on Healthy People 2020, right? Well, now let's look at lack of insurance coverage. You can see over on the right-hand side, kind of above the little red area where Yellowstone County is listed, we, in terms of access to health insurance coverage, are actually similar not only to where we were in 2005, we're also similar to the US. So if I only present this information, my community members may look at me and go, well, good for us. We are doing well on this. Now, I'll show you in a few slides the Healthy People 2020 numbers, which show we're well below where our goal should be as a nation. And so just because we're similar to the US doesn't make it good. And that is something that is really important for not only your partners, but also your community members to understand. Because we tend to just think, if we're doing what everyone else is doing, we're doing pretty well. And we really need to get people out of that mindset. And that's what Healthy People 2020 provides for us. Our third area chosen for priority was mental health and improving mental health. So this is from our community health assessment. And one of the components that has been very difficult for us in this area, we know that mental health is an issue in Montana. We rank among the top in rates of suicide. We're in the top 3 every single year. Yellowstone County alone sees a good majority of those in our own county. And so we know this is an issue, but again, we're seeing that overall we're similar to 2005 and similar to the US when we look at just this question of whether people are experiencing fair or poor mental health. So here is one area where this question that our community had chosen to look at had no comparable Healthy People 2020. We did in the end decide to use it as one of our priority health issues, but it was very hard to do because I had no benchmark to tell people. And so we kept reverting back to talking about suicide, where the issue for us is actually a little bigger than suicide. And so this is really my lesson learned, and I'm learning it right now because we're actually about to redo our community health assessment. I would look at all my community health assessment questions and make sure that you have a comparable Healthy People 2020 question. That should be one of the very first things you do, because if not, it's hard to find that benchmark data. We did another question where we talked about helmet use. Very important, right? Helmet use is big. In Montana, we have ATVs and motorcycles and horseback riding in addition to all the other things, and we wanted to look at helmet use. Great idea, we put it in, there was no benchmark we could find for it. So it ended up being really useless data for us, unless maybe we'll see some trends moving forward, but that first time around we weren't able to use it at all. So what we did in Yellowstone County, our response to the community health assessment was to develop a community coalition, and it's called Healthy by Design. And the idea is like any other coalition, but really to look at what are those priority areas and bringing our partners together. The idea behind Healthy by Design is to use this definition from CDC. It's really about making our community a place where people can choose to be healthy. You can still choose to be unhealthy, but you can choose to be healthy too. So this is where we have come together as a community to work on these issues. As I said, we chose 3 priority areas: healthy weight, mental health, and access to health care. This picture here is actually from a gardener's market we do as part of one of our healthy weight implementation strategies to improve access to nutritious foods. So this is from a gardener's market that occurs weekly in our health department parking lot, and I just love that picture because I think those kids are about the cutest. So here is how we've actually written our goals and put forward where we want to go. You can see we have our health needs assessment results. Then we compare it to the Healthy People 2020 goal, and then we've set our own Yellowstone County goals. So just to give a little background here, moving forward, we have as a community chosen to go on the 3-year cycle of the community health assessment to meet the hospital IRS requirements. So you'll see we have 2014, and then we'll have a 2017 and 2020 in there. And then we made Healthy People 2020 that big component of this. And one of the really positive things that I think we've done is we've also changed the way we present this to the community. So you remember my first slide, I talked about the percentage of people overweight or obese. And in this slide, I'm talking about the percentage of people at a healthy weight. So we've tried to kind of shift it to talk about how we want to reach a positive goal. Instead of decreasing, we're trying to increase from that positive perspective. This one was really straightforward for us from a Healthy People 2020 standpoint, right? Obviously, we're not meeting it. We need to move forward. Here is our access to healthcare goal. And again, remember when I showed you the slide, we talked about how it was similar to the US. And so this is one where we really had to work with our partners to say similar doesn't mean positive. And Healthy People really gave us that message and that line to show where we needed to go. You can see actually in our goals, we do not meet the Healthy People 2020 as a goal. We're only trying to get to 92%. And that was, again, a very good discussion, a rich discussion on what's realistic and that we want to strive to reach Healthy People 2020 goals, but that may not be possible for us in our community with what we have the ability to do over the next 7 years. And then here is the mental health one, which we're still kind of struggling along with. And this was, like I said, my big lesson learned. Because there was no Healthy People 2020 goal, we kind of had to set our own benchmarks and see where they would be. And you can see through various and many discussions, our Yellowstone County goals actually decreased from where we're at in 2011. And that was because there was a lot of feeling of the community health assessment maybe didn't capture everything going on. We know unless if our population continues to rise, but we're not dealing with mental health, we're actually going to see a decrease in the percent of people rating their mental health as good, very good, or excellent. And so we kind of backslid on this one a little bit. And sitting at the table having these discussions with your partners and community members, this is the time that I really miss that Healthy People 2020. Because it became a whole different discussion without that benchmark piece in place. And so that's something I would have definitely done differently. One other challenge, I already kind of talked about the no matching Healthy People 2020 goal. But the other challenge we had this time around is changing from 2010 and to 2020 Healthy People. And I don't know if anyone else is in that situation or if you've looked at that yet. There's a lot of measures that are different. And in my own personal opinion, they didn't tell me to say this, but Healthy People 2020 provides some realistic goals that I'm not sure the Healthy People 2010 did. And so I really think they're better measures. But what happened to us is we actually had some priority areas where we weren't meeting Healthy People 2010. And I do the press releases and I splash things out there as much as I can and put it on websites and I write it in grants and do all that. And then all of a sudden Healthy People 2020 came out and lo and behold, we're good now. We have met the measure. And so that was a really hard kind of time for us in our messaging to step back and take a look at that. And so I just encourage, if you're going through that transition, to really ensure you've looked at all those pieces before you go forward with your message to your partners and to the community, to make sure you've crafted that appropriately. Because in our specific case, we didn't want to stop doing what we were doing. I still wanted the partner support, the funding, the other pieces that were coming forward because we had this great program that still needed to move forward. And so it's really important that you have checked that out and are clear yourself on where you stand with the 2010 and 2020. And be prepared to answer that question of how come before you told me this is a big issue and now if I look at the data it's not a big issue. So just prepare yourself for that question. Some of the real strengths which have come up in all these presentations is that it really helped us as a benchmark data. So it did help us choose our priority areas. It's helped us set our goals for the future. It helped us easily set goals as partners because we all agreed that Healthy People 2020 could serve as benchmarks. And so in those places that we had that benchmark data, the discussions, in my opinion, were a lot more positive. They brought forward a lot more strategies on what we could do than those areas where we didn't have the Healthy People 2020. It does bring that easy community attention. So as you're talking about your message, not only the graphs, but even the headlines that you can have where you say, X% of your residents are overweight or obese compared to the Healthy People 2020 goal, or at a healthy weight versus what it should be. And it's really easy to for the media to understand that message, and so you can get a lot more media attention by kind of throwing out Healthy People 2020, and they see it as this national benchmark. The other thing it's helped us do is gain funding. So I'm sure you have all written grants, and I can write grants with the best of them, and I can guarantee you I write the best grants when I can directly say, here's where our county's at, here's where the goal is at, we have a deficit, I need this funding to get my county to that level. And so knowing that message and having that message in your head is going to move you forward a lot in that funding area too. That was it.
We do have time for 1 or 2 questions for Hillary. Yes.
One question about the absence of a 2020 benchmark. I know you kind of frame that as in the context of wish I had one,
Yeah.
but you could also frame it in the context that it gives you flexibility and latitude to develop a local measure
Yes.
that's meaningful to your community because of the absence of a 2020 associated measure. For instance,
Yeah.
with mental health, when you had, which is critical, I believe,
Yeah.
you had like excellent, good, fair mental health. You could develop proxies for those that have to do with functionality versus just a self-assessment of status. I could say I have excellent mental health, drink a 12-pack Busch Light every night, and say my life's great. But, you know, if I'm drinking that 12-pack, it's probably not. But if I ask questions related to my functionality, how many days at work do you miss?
Yeah.
Do you feel that it affects your ability to do normal driving, you know, the kind of the tasks of daily living type stuff? You might be able to develop an assessment of what that really means in your community in the absence of a measure that says fair, excellent, good.
And actually, that's a good point, but I should bring forward one thing that I didn't clearly state, which is that mental health is part of Healthy People 2020. So it is a topic area there. We did not ask the questions in a way that we could directly compare it. And so just by changing the way we'd ask the question, we could have eliminated the issue altogether had we looked at it in advance.
Okay,
So it wasn't, I didn't make that clear, it wasn't a lack of a topic area, it was a lack of linking our questions directly to Healthy People 2020.
Yes.
Did you at all use the Robert Wood Johnson County Health Rankings in comparison across the board here?
Not in this case, no. In the health assessment that we have moving forward right now, we have actually been working with the contractors who do our health assessment with us. We have chosen specific measures from the county health rankings for them to put in our final report. Places where we feel like our questions don't cover, for example, the number of fast food restaurants per capita. We don't have any kind of measure that does that, but we need that. So we're using some of those measures in our final report so that when we choose priorities, we've considered it. The rankings to us have been difficult because we've had to really work on the messaging of that positive versus that negative. And so it's been a little touchy from time to time to use those specifically, but we are planning moving forward to include those.